Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online, news that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Welcome to Newsmakers. I'm Anthony Moreno. On the program, we learn more about efforts in New Mexico that aim to improve child and adolescent mental health. And we get a tour of the Zuhl Museum on the NMSU campus in Las Cruces. But first, we turn our focus to some recent federal actions on immigration and border security. President Trump declared a national emergency at the border to address these issues that he campaigned on. And according to the Department of Homeland Security, immigration authorities are now allowed to enter schools, healthcare facilities, and places of worship to conduct arrests. KRWG's Johnny Coker reports some local organizations are preparing for these changes.
The Trump administration's executive actions related to border security and immigration are already having ripple effects across southern New Mexico. Between the threat of ICE raids and changes in federal immigration enforcement, there's uncertainty across churches, school districts, nonprofits, and refugee services alike. Jesus Osuna is a refugee from Venezuela. His family is among some of the last migrants to be processed into the United States using the CPB-1 app, a program shut down by the current Trump administration, originally created by the Biden administration to allow migrants to secure appointments with border officials at legal points of entry. Osuna said he was facing extortion in his home country and decided to flee the government corruption and gang violence of Venezuela with his wife and 3 children. He eventually had to cross the Darien Gap, facing hostility throughout the trip, with his family even being held at gunpoint during the journey.
Because of the rain, there were a lot of people who drowned in the river. The force of the river took them. Another thing we saw were robberies and assaults. The situation is that they try to rob you, but if you resist, they will kill you.
Osuna and his family are amongst the last guests staying at the Border Servant Corps shelter in Las Cruces. Osuna said he feels the anxiety surrounding migrant communities in the United States, but despite the uncertainty, he hopes to make his way to the Midwest to find stability for his wife and his children.
We want to demonstrate that we can do things right, that we will follow the customs and the laws, and demonstrate that we really are here to work to find a better future for us and our children. We will study. We will work, pay our taxes, and do everything correctly.
According to the Border Servant Corps, the organization has provided services to over 150,000 migrants released from the Department of Homeland Security since the fall of 2021. But the halls are virtually empty now. Kyle Boyd is the deputy director of the organization and said that having infrastructure in place for incoming migrants is essential to keeping the burden off local borderland communities.
If organizations like us go away, then everybody's going to have to figure out where they're going to get all of these different components. Situations change, policies change, even such things as natural disasters change. You know, hurricanes can drive migration and all kinds of different things can drive migration. So knowing that, our objective is to stand ready for when we're needed again, because we do expect to be needed again.
Above all else, Boyd says he hopes the community can view migration from a humanitarian angle.
All of the guests that we've worked with, whether they're coming from a port of entry or coming from Border Patrol, have gone through the Homeland Security vetting process. And Homeland Security has deemed them eligible to be released into the United States. Those that they deem unreleasable are then referred over to ICE for whatever process goes on their side. We would encourage people to step back from all of the rhetoric and realize that whether it's a migrant who's coming here from Venezuela or somebody in the United States fleeing a hurricane in Louisiana, these are just humans that are asking for our help.
The anxiety of expanded federal crackdowns on immigration extends beyond shelters. LCPS Superintendent Ignacio Ruiz penned a letter to the community in response to executive changes that would allow federal agents to arrest individuals without legal status in sensitive areas, including schools. The letter assured the community that all children are welcome in public schools regardless of their legal status. Areas of worship are also preparing for changes in federal law. Joseph Bach is a friar at the Holy Cross Retreat Center. The center has historically opened its doors to refugees, and Brother Bach says he's been in communication with school and church leaders about the potential of ICE raids in sensitive areas.
So if someone does have a warrant with an individual's name on it, that's one situation. If they are just coming in and wanting to search through the property and go into different rooms and go into different parts of the building, then that is not acceptable or okay.
Bach said that beyond immigration policy, he hopes that the federal government takes a closer look at the root causes of migration, and rather than political infighting, focuses on policies that preserve the dignity of individuals.
The church, a school, a hospital, a place where people receive health care should be a place where people feel safe and where they feel like they can go, to have their needs taken care of. And at the end of the day, we need to look at all as made in the image of God, our Creator, and to embrace them and to make sure that at all costs, their value, dignity, and worth is protected.
As federal policy shifts, organizations across southern New Mexico are anxiously waiting to see how ripple effects of immigration crackdowns may change the dynamics of community life, from public schools to private worship. For KRWG Public Media, I'm Johnny Coker.
A new program at the University of New Mexico Health Sciences Center is launching a virtual mentoring program designed to help improve youth mental health services in the state. Joining us now to discuss Project ECHO at UNM's Health Sciences Center is Peter Holguin, MD, a child and adolescent psychiatrist at UNM. Peter, thanks for joining us.
Thank you so much for having me.
Can you start off by sharing a little bit about Project ECHO and what it entails?
So originally, Project ECHO started out as a virtual platform which consisted of a didactic presentation on particular topics, originally for helping primary care providers treat patients who had hepatitis C to improve access to treatment for hepatitis C, and has since been used in other areas of medicine, including for HIV medicine, alcohol use disorders, opioid use disorders, etc.
So how is this specific program going to make a difference in addressing the needs of child and adolescent mental health in New Mexico?
The goal of this program is to use Project ECHO specifically to improve outcomes in child and adolescent mental health by, again, using those 1-hour sessions. And for our program specifically, it will be on the first and third Wednesday of each month. But sessions will be focused on mental health related topics for youth. And those presentations are followed by case presentations from the participants. So if anyone who works with youth, including a pediatrician, a family medicine physician, school counselors, nurses, etc., they can present that patient to the ECHO platform to get recommendations on anything ranging from recommendations for medications to manage different types of mental illness, or recommendations on different types of talk therapies that can be helpful, or even something as practical as coping skills that can be utilized in really anywhere by youth to help relieve symptoms of mental illness like depression or anxiety. So the goal is really to use this platform to reach out across the state to providers, especially in more rural areas where access to mental health resources and treatment can be significantly limited, or wait lists can be very extensive, and kids can go months, sometimes longer, waiting to receive treatment for their mental illness.
We've certainly heard a lot about the challenges facing healthcare in rural areas and mental health services as well. I'd like to hear a little bit more about just what we know so far about the challenges facing youth mental health in New Mexico. Can you give us an understanding of just what the landscape is looking like in the state?
That's a great question. So there's actually some data gathered from a survey called the New Mexico Youth Risk and Resiliency Survey. So this is a survey that is done with youth in New Mexico from grades 9 through 12. And they ask about a variety of different topics, some related to mental health, including asking about if youth are experiencing different behaviors such as self-harming or past attempts of suicide. And what the survey found in 2019 was that approximately 23% of youth, again in grades 9 through 12, had been engaging in self-harming behavior. About 44% had been having feelings of hopelessness or feeling sad, and 10.4% had a suicide attempt in the past. So I think this is just really important to highlight the significant degree of psychiatric symptoms and distress, and in some cases leading to really serious suicide attempts. And I think just goes to highlight the need for mental health services for our youth in the state.
Is there anything in particular that's affecting youth today that maybe wasn't an issue decades ago?
That's an excellent question. I think there's probably a variety of factors. As we all know and lived through, there was the COVID pandemic, which had a pretty significant impact on social connections, youth's ability to see peers in school because of the COVID lockdown. And even as a result, delays or I guess challenges completing schoolwork and meeting those educational goals, in addition to legalization of different substances like cannabis, which can have a variety of mental health risks associated with it, with which people may not be aware of. And then the proliferation of internet access and social media, I think it's really contributed in a lot of different ways to the mental health challenges that we see in youth, not only in New Mexico, but also across the country.
So how do you feel this program can address the gaps in youth mental health services in New Mexico? You brought up the challenges of rural areas, but are there any other areas that New Mexico needs to improve on when we're talking about these gaps in mental health?
I think in particular, the degree of lack of mental health providers, especially in rural parts of the state. So, certain counties like Bernalillo County have a wealth of mental health providers, including child psychiatrists, but not uncommonly in these smaller counties, really the majority of counties across the state, there really is a dearth of providers. And the people on the front line working with these youth facing significant mental health challenges, which in a lot of cases can be really quite complex. And you may have a pediatrician in a rural part of the state, like Silver City, who has a youth who is experiencing serious signs of mental illness, like self-harming behavior, thoughts of suicide, or even recent suicide attempts. And this can be very overwhelming for those who do not have any specific mental health training or psychiatric training. So really, we want to help empower these providers or people in different professions to improve outcomes and point them towards resources, or help them to manage mental illness as best as they can while they wait for referrals to child psychiatry or to a therapist to be processed and for them to start seeing mental health professionals. Because unfortunately, when mental illness goes unaddressed, there can be further complications down the road, including impacts on a child's education. There can be increases in substance use. And unfortunately, some of our youth pass away from suicide, which is just absolutely tragic and heartbreaking. So we really hope to utilize all the great and dedicated people working with our youth across the state to help those in need.
Does this program also perhaps offer opportunities for collaborations when addressing the needs of mental health of youth in our state?
Absolutely. I think that's a strength of Project ECHO. One of the things that the ECHO program emphasizes is the all teach, all learn paradigm, in which, of course, we have the subject matter experts who present during the presentation on a particular topic, but also utilizing and leveraging the vast knowledge of those participating in the ECHOs as a viewer, because they often are aware of resources that someone in Albuquerque may not be aware of. And it really helps to build a community and a network of resources to even reach out to outside of the ECHO programs. So the goal would be to make all these connections across the state, and again, really make the most of all the dedicated professionals we have working with our youth.
Navigating healthcare in New Mexico may be a challenge for just about anybody, but when we're talking about youth mental health services and finding out resources that may be available, how challenging is that for a young person or perhaps their parents or legal guardians?
I think that can be a huge challenge. I mean, even for myself, I was not particularly aware of all the ins and outs of mental health or mental illness until I completed my medical training. And then to have, a parent or a child in a rural part of the state who may not have a lot of baseline knowledge or awareness of mental illness, that and coupled with stigma related to mental illness, which I think has improved over time as education on the topic has proliferated. But it could be incredibly challenging for youths or their families to find help and assistance. And I mean, even you see these articles or news reports about these youth who basically end up being boarded in emergency departments waiting for placement in a psychiatric hospital just because of the lack of availability of beds. And so it's a huge challenge finding resources.
Now, you mentioned rural areas. We've certainly brought it up a couple of times, but is there anything that you think that policymakers may be interested in learning about so that there can be some sustainable improvements in rural areas when it comes to resources for youth mental health?
So I think there are some policies in place to really help address rural areas, including improving resources and access to mental health. So there are programs in place for loan forgiveness and loan repayment programs for basically a certain number of years of service, which can be a significant draw for providers who have a significant degree of medical debt. So I think programs like that are really important, but I think just it's really important for lawmakers to understand that that it is having a big impact on youth in rural parts of the state. There was a youth I had seen here at UNM Hospital coming from Silver City, so that's at least 4 hours away. And that's not always a feasible, option for a lot of folks when you factor in the time for travel and resources like paying for gas. All of these can be huge challenges. So I think it's important for lawmakers to be aware of unique programs like Project ECHO, so that they can be expanded and funded to really come up with unique ways of helping those across the state, including in rural areas.
Can you share a little bit more about the mentoring opportunities with this, the mentoring sessions with this program?
Yeah, so in terms of mentoring, the participants in our ECHO, they're able to interact with us in a variety of ways. So one way they can interact directly with us is by submitting a case. Again, if there's a particular youth that they're seeing or working with, and they're having a particular sort of challenge that they're not quite sure how to address, be it, not sure where to start with medications to treat something like depression or anxiety, or not sure how to keep a youth safe when they're experiencing thoughts of suicide. So they can directly reach out to us with a case, and then they can present it and we can make recommendations specifically tailored for that challenge that they're having. And so and then that can provide kind of an ongoing sort of a relationship too. It could be possible to continue to check in on that initial sort of consultation as things kind of change or develop, to provide continued assistance. And so I think that type of mentorship can be really, really key, since, again, some of these very complex mental health challenges that youth are facing can be very overwhelming, especially if you don't have that psychiatric training. So I think that and the benefit of it as well is we have clinical psychologist Dr. Natalie Price, so she brings expertise on areas of different psychotherapy modalities and coping skills, and the co-director for our ECHO, Dr. Shadid, she's a child adolescent psychiatrist. She can also provide recommendations as well. So I think we have a great team to really help mentor these frontline workers working with our youth.
I have less than a minute left with you, but I do want to hear your thoughts on, some educational opportunities, some medical education opportunities that may be also available. Yeah,
so with our ECHO program, we really want to cater to the needs of those who we work with. So we are always encouraging for anyone interested in joining the ECHO to reach out to our email and let us know, those things that they're really struggling with, so that, again, we could tailor our presentations to meet the needs that they're having in that moment, because they can certainly change over time or can vary regionally. So we really want our focus on education to be really practical and focused on what mentees are needing, where they're needing the support.
Dr. Peter Holguin is a child and adolescent psychiatrist at the University of New Mexico. Dr. Holguin, thank you for joining us.
Thank you so much.
Moving on, the Zuhl Museum at NMSU provides many resources. It houses petrified wood, fossils, and minerals that may be described as part art gallery and part natural history museum. Producer David Vasquez III has more on what the museum has to offer in this community connection.
The Zuhl collection was donated by Herbert and Joan Zuhl back in 2000. It was originally displayed in the library, in the Zuhl Library, which is named after them, obviously. And then in 2004 is when we added on to this building and created the Zuhl Museum. The Zuhls originally, they had a gallery in New York where they would collect these pieces. They would go out to find all these huge logs and they would slice them up, polish them, and then sell them to interior designers, other museums. Basically any large piece you're gonna see of petrified wood in any museum, Smithsonian, Houston Museum of Natural History, any of those big museums is gonna be a Zuhl piece, most likely. And then when they retired, that's when they came to Las Cruces, simply because they liked it here. Each gallery has its own theme. So we have, you come in the doors and you see our Wow Gallery. Wow Gallery, it's basically all of our really awesome things. It also houses all of our minerals, some of our really fantastic fossils and petrified wood. So it's just basically, it's a room where you walk in and you want to say wow. We also have a really fantastic art piece that's in there that's on loan from the university. Then we have the Petrified Wood Gallery. And this houses the majority of our petrified wood, and it's broken down into locations. So we've got Arizona, Oregon, Nevada, and then kind of a little around the world section that's a few pieces from different places around the world, China, Madagascar. And it is the largest and the finest collection of petrified wood on display in the country. And then we have our History of Life Gallery, also known as the Fossil Gallery. That's the kids' favorite usually. That one goes through geologic time. So you make your way through all the invertebrates, then you hit the dinosaurs, and you work your way through them, and then you hit the mammals, and that's the ending. And we're unique because our fossil skeletons, unlike most museums, which have casts on display, ours are real. Ours are the actual fossils. We're open Tuesday through Friday, 12 to 4, and then every second Saturday of the month, we're open from 12 to 4. The educational part of this is my favorite part of the job. I love giving tours. I love, especially to like the school kids. My favorite groups are the little pre-K kids or the senior groups we get. Those are my absolute two favorites. I like all of them, but those are my favorites because they are the most engaged and they're the most excited to be here. And my student workers I have, they're the same way. They're very passionate about it and they love to talk about the collection. So if you come in, feel free to ask any of me or my student workers anything. They love to talk about it.
Thank you for joining us this week. I'm Anthony Moreno. We'll see you next time on Newsmakers.